My first day, we were actually on the NICU, and guess what? Y'all will not believe what happened. So, me and two other students, we actually got left. Yes, y'all.
Welcome to Dunkin'. What can we get started for you?
Yes, ma'am. May I have a iced caramel latte?
What's that name?
I'll take a medium.
Medium iced caramel latte. Any flavor?
Caramel.
Oh, sorry.
Thank you.
Thank you.
Hi everyone, my name is Diamond, aka the Nurseaholic. Today, this vlog is about my first day of clinical in the fall semester of 2020. If you're new to my channel, welcome. If you are returning, hey Nurse Bae, welcome back. So, super excited to be doing a vlog about clinical. So yeah. If you don't know already, I am in nursing school. I am in an accelerated program. So right now I am in the parking deck, waiting on some of my friends, and I got Dunkin' Donuts. So I just wanted to let you everyone know that currently with the facility that we are at for our clinical, we have to arrive with this eyewear on, and then we also have to wear a disposable mask, and then once we get inside, they will give us our own PPE from the hospital so that they can ensure that it's actually safe and hygienic. Our program is 13 months long, and so far we only have 7 more months left. It's crazy. Nursing school goes by so fast. I'm super excited. Today I will be in the NICU, so I will be on the NICU floor. Know what floor, or I really do not know what specialty I would like to go into after I graduate, but I really was I was really depending on clinical to show me what specialty would be best for me. Due to COVID, they kind of cut that short. So I am very ecstatic, and I literally had 1 day of clinical, and then they canceled it due to everything that was going on and that we are still dealing with here in the United States. I am very ecstatic to be here today, and I'm very grateful because I really have I really feel like I have the heart to work with mothers and children. So I feel like I'll be great for the L&D floor, but I also have like a lot of patience, and so I believe that I would work great on the NICU or the PICU floor. So yeah, I am super excited. I know I probably look crazy with this with this face shit on, but hey, it's our new normal. I'm just trying to get used to it. It's actually very comfortable. It doesn't really bother you. So yeah, I'm just about to listen to my music as I wait for my friends. Let me get you.
What happened to, I'm just gonna put a little liner on, a little gloss.
You know I had to do the red lips.
I knew you did.
It's like, period. Why the, hey Bree. Oh my goodness. Hey Bree. Hey, what's up? Hey y'all, I am back. So I finished my first day of clinical. I feel kind of silly with this still on, but surprisingly people are really out here wearing face shields and eye masks, normal people. But after my first day, we were actually on the NICU, and guess what? Y'all will not believe what happened. So me and 2 other students, we actually got left. Yeah, somehow our preceptor forgot about us and we were left on our floor. So we were actually in the NICU while other students went to labor and delivery. So on the same floor, but different sides of the floor. But somehow our preceptor forgot to come over to us and make us aware that, hey, you can go home. So we stayed an extra 3 hours when we could have been at home, relaxing, studying, getting food, getting sleep, you know, anything with the rest of our day. But you know, so that's something interesting that happened today. I actually love the NICU. I can see myself working in the NICU. I can see myself working in the NICU, but they really do not have a high rotation of workers. It really is like once people get in the NICU, they stay there. One myth that a lot of people have about the NICU is that you are just sitting around rocking babies, coddling them, but that is not what happens. A majority of the time, the babies are remaining in their beds. You just have to remember that if a baby is in the NICU, the baby is obviously sick. At the facility that we were at, they have 2 different acuity levels. It's either level 1, which is a higher acuity, and level 2, the babies are a little bit more healthier. I say they're closer to being discharged. It was very, very interesting. A lot of the cool things that we were able to see, I've written down of different cool things that we were able to see. So some of the cool things that we were able to see, we were able to listen to heart and lung sounds. But because these babies are more sick, they're not healthy. That's the reason why it was cool to listen to their heart and lung sounds. One in particular that was very, very unique is with a patient who had a rare condition that can be genetic called DeGeorge's syndrome. That was super, super cool to listen to that baby's lungs, and the baby also had tachypnea. We were able to witness a blood transfusion. So blood transfusions in the NICU are a little bit different than they are with adults. In the NICU, you actually put the blood transfusion through an IV, but they use a syringe. So that was super cool. We also learned about the significance of residual. We did learn in class, but she just reiterated it to us today, that if it's not like a ugly green color, you put it back in to the baby for the nutrition and all, because there is important electrolytes like potassium. And you know, when you get rid of potassium, that's not really a good thing. We also were able to witness an intubation. Oh, one thing that I will most definitely compliment this NICU on, they most definitely utilize teamwork. Teamwork. There is always an MD on the floor. There is always a nurse practitioner on the floor. There is always respiratory therapists on the floor, and there is always unregistered nurse. And I would love to compliment this floor on that, because every single part of the care, you've seen all of these people coming together. And I really like how they did their huddles or their rapport before they start a shift, planning the newborns' care for the day. The doctor would even ask the nurse, like, hey, what do you think? And the nurse would comment, okay, well, based on the care that I've seen these past few days, I think we should do this. And the doctor would comment, okay, well, the reason why we should do it this way is because of this. And so I really liked how the doctors and the nurses and the respiratory therapists all collaborated. And the respiratory therapist, she even collected blood, which labs for some of the nurses, just to alleviate some of the work that they have to do, because they have to do so much. Majority of the nurses on this NICU floor, they had about 4 patients, and that is a lot. You're basically the parent while the parent is away, but you're also the parent in addition to being that patient's nurse. So that's why in the NICU, a lot of people think like, oh, we're just, you know, rocking babies to sleep all day. Not at all. You're collecting labs. You're, in addition to that, feeding the child. In addition to that, concerns about vital signs. So much that I did not know went into care in the NICU. So some more of the things that we were able to do, we were able to swaddle a baby, we were able to hold a baby, and the baby that we were able to hold, or the baby that we held, she actually, so her mother takes prescribed opioids. So when the child was born, she was shaking a lot. So with the child whose mother took prescribed opioids, it affected the child in a way where she was trembling a lot, was very irritable, and was hard to console and to calm down. And she even had difficulty feeding. Some other things that we were able to witness, bilirubin testing and light therapy, which can either be blue or white light for the UV rays. We were able to witness a nurse suctioning. We were able to witness, so one of the things that I noticed that they do, so number one, they stick the child in the foot a lot when it comes to collecting labs. In addition to that, when they do that, they squeeze, not really squeeze, but lightly squeeze the foot backwards towards the child's head in order to get the blood out. And then when it came to some children who have a low birth weight, a lot of the parents or the mothers, they had preeclampsia, so the child comes out with low birth weight. So with that, we witnessed one child, you had to like manually help the poop come out, or fecal defecation. You manually did that in order to get the breast milk poop to come out. And again, vitals and CPAP. So that's what we witnessed. So overall, I would say that I love the NICU. I would work in the NICU because I love the teamwork aspect that I witnessed on this particular floor. So because of the facility that we went to and the floor that we were able to have our clinical on, I will work in the NICU. Is that the same at every hospital? Probably not. But because of my experience today, I will most definitely work in the NICU. Besides being left and having to do extra hours that we necessarily didn't have to do, yeah, today was a good day. Overall, my experience in the NICU was great. It was phenomenal. But the only thing is, my feet were hurting so bad. So I have on nursemaids, and supposedly they're supposed to be so comfortable. But working a 12-hour shift, by, I want to say, hour 5. By hour 5, my feet were killing me. It did make me realize the importance of having comfortable shoes. So a lot of them suggested Dancos or Allegrias. I've seen a lot of people with New Balances on, or Asics on, and they suggested some other shoes too. Oh, and today I did bring, you know, my stethoscope with me, but on the NICU floor, you do not need it. Well, on the floor that we were on, we didn't need it because every single bed has its own stethoscope. Plus, this one is too big for the small babies because most of them have low birth weights. So I would like to thank you all for watching. Again, I am the Nurseaholic. Make sure you hit the like button. Make sure you also subscribe and hit that bell in the bottom right corner so that you can be notified every time I upload a video. I really enjoyed the NICU, And I hope all of you are able to experience the NICU specialty, because it really is special. So I look forward to seeing you all in my next video.